HIV, which stands for Human Immunodeficiency Virus, is a retrovirus that mainly attacks a specific part of our immune system called CD4 T cells, or T helper cells. When the number of these CD4 cells declines, we become more susceptible to different types of infections. When they get low enough, or you acquire some of these opportunistic infections, you have acquired immunodeficiency syndrome, or AIDS. AIDS spreads through interaction with specific body fluids, such as blood, semen, vaginal fluids, rectal fluids, and breast milk. Common modes of transmission include unprotected sexual intercourse, sharing needles with an infected person, and transmission from mother to child during childbirth or breastfeeding. "40 to 60% of people will experience a sign that the immune system is reacting to the presence of the virus, called a seroconversion illness, 2 to 4 weeks after exposure. This usually mimics a mono-like illness with fever, fatigue, and swollen lymph nodes. But many people will be asymptomatic despite infection, which is why it's important to be tested regularly if you have ongoing risk factors. On average, after about 6 months of infection, your immune system has done as well as it can controlling the virus, and you reach a viral set point. The set point determines how quickly, without treatment, you will progress to AIDS. This can take about 10 years on average, but can happen in as little as 2 years. The symptoms are dependent on the type of opportunistic infections you acquire. Healthcare professionals employ blood tests to diagnose HIV. We currently use 4th-generation testing, which uses the standard antibody testing to see if your immune system has ever seen the virus before. But it also looks for a specific protein called P24, which allows us to decrease the window period, which is the time from when you acquire the infection to when the test is positive, to 15 to 20 days from exposure. While there used to be a lot of stigma surrounding the virus, HIV is now very treatable, but is a lifelong condition. Antiretroviral therapy, or ART, is required to treat and control the infection and limit the potential ability to transmit the virus. There are currently 11 different one-pill-a-day medications on the market, or a once every 8-week injection available to suppress the virus. As long as the medication is taken to control the virus, patients can expect to have a life expectancy that is the same as someone without HIV, with little to no side effects. Preventing HIV and AIDS is a fundamental part of the battle against the virus. Safe sex practices, including using condoms, significantly reduce the risk of transmission during sexual intercourse. Regular HIV testing helps individuals know their status and take appropriate actions. Avoiding sharing needles or other drug paraphernalia is crucial, especially for individuals who use injection drugs. Additionally, pre-exposure prophylaxis, or PrEP, PrEP, is available for those at high risk of being exposed to the HIV virus, which can provide an extra layer of protection. There is also post-exposure prophylaxis, which can be started within 72 hours of a high-risk encounter, such as condomless sex or needle stick injury, to reduce the risk of HIV. HIV and AIDS is a complex condition, but with proper understanding, early diagnosis, and effective treatment, it can be managed, allowing infected people to lead normal, healthy lives. Thank you for watching this video. Together, we can work towards a world where HIV and AIDS is better understood.